services. In addition, the handbook will be accompanied by the Knowledge and Skills Reference Guide in Cancer, which identifies the knowledge and skills that pharmacists required for the provision of such services, thus offering guidance to pharmacists, academic institutions, and CPD providers. Both publications will be presented today at this event, and they are part of the FIP Practice Transformation Programme on NCDs. Our speakers will explore this in further detail in this webinar. But first, to introduce myself, my name is Inês Nunes da Cunha, and I am the FIP Practice Development and Transformation Project Manager. It is an honor and a privilege to be moderating this event today. For this event, we are joined to a panel of fabulous speakers, and I want to sincerely thank each of them for taking the time to prepare their presentations. Today we have with us Dr. Evelyn, Dr. Folakemi, Dr. Matthew, and Dr. Dalia. As you can see on this slide, we have some announcements. Please note this event will be recorded, live streamed on FIP YouTube, and the recording will be available at events.fip.org. To all those listening, please feel free to send your questions through the Q&A box provided, and I will do my best to manage all the questions so that at the end we will be able to address those questions. You are welcome to provide feedback to webinars@fip.org. I would like to take this opportunity to promote benefits of memberships with FIP, including the events and webinars. FIP is a global body representing over 4 million pharmacists and pharmaceutical scientists. If you are a pharmacist or pharmaceutical scientist and you would like to become a member, please register on FIP website at fip.org. Today's program, we are firstly, I will introduce the FIP Practice Transformation Programme on Non-Communicable Diseases. Next, Evelyn will present the contribution of pharmacists to better cancer care. Dr. Folakemi Odedina will talk about the pharmacist's involvement in cancer management and in diversifying clinical trials participation. Matthew Eng will present the Cancer Care Handbook for Pharmacists, and Dalia Bages will present the Knowledge and Skills Reference Guide for Pharmacists in Cancer. And lastly, you will have the opportunity to ask questions, and our panelists will make some closing remarks. There are a number of learning objectives for this webinar. You will learn about the role of the pharmacists in the prevention, screening, care, and management of cancer, challenge and opportunities for pharmacists in implementing cancer-related services, and also the knowledge and skills that pharmacists need to acquire to support their role in the delivery of cancer-related services. FIP is working in the FIP Practice Transformation Programs on non-communicable diseases that aims to provide tools and strategic support to FIP member organizations to develop and implement pharmacy services that can have a sustained positive impact in the prevention, screening, management, and treatment optimizations of NCDs for improved health outcomes and health systems efficiency and sustainability. While this project will have a particular focus on low and middle income countries, it will encourage implementation by countries of all income levels. On the next slide, you can see that the program includes the development of practice support handbooks, the knowledge and skills guides, implementation guidelines and support, and training for competence development in each of the 5 main NCD areas. We already launched last year the diabetes. In July, we launched the mental health knowledge and skills reference guide and the handbook. Last week, we launched the chronic respiratory diseases. Today, we will present during this event the Cancer Handbook and the Knowledge and Skills Reference Guide. And in a few weeks, we will present the last one, the Cardiovascular Diseases Handbook and Knowledge and Skills Reference Guide. As you can see on the next slide, the FIP Practice Transformation Programme is alignment with the many FIP development goals, special with advancing integrated services, medicine's expertise, and people-centered care. So today, on the next slide, you can see that we will focus on the FIP Transformation Programme on cancer. And on the next slides, you can see the layout of the two publications. Today, we will present these two publications, but the official launch will take place on 12th October. And you can access to these two publications at the FIP website and also through the FIP microsite on NCDs. Without further delay, I will now present our first speaker, who will provide a presentation on the contribution of pharmacists to better cancer care. Dr. Evelyn Handel is an oncology pharmacist based in Philadelphia, USA, and is the Director of Drugs and Biologic Programs at the National Comprehensive Cancer Network. Evelyn is also currently serving a 2-year term as President of the International Society of Oncology Pharmacy Practitioners. It is a huge pleasure to have you as a speaker today, and I will hand it over to you. Thank you so much.
Hello, everyone. Great to be here. Good morning, good afternoon, and good evening, depending on where you're at. I'm in Philadelphia, Pennsylvania, in the United States, and proudly representing ISOP at today's webinar. And today I'll be speaking a little bit on the contribution of pharmacists to better cancer care. And to focus a little bit on the global burden of cancer in the current time and looking ahead, currently non-communicable diseases, or NCDs, cause approximately 41 million deaths per year, and this is equivalent to about 74% of all deaths globally. Unfortunately, many of these are in low and middle income countries, and the two leading causes of NCD deaths are cardiovascular disease and cancer. And again, focusing specifically on cancer today, currently the number of new cancer cases per year is approximately 19 million. And looking ahead into the future in 2040 and 2070, you can see at the bottom corner of the screen that these numbers are anticipated to grow. So this presents an opportunity for us as pharmacists, as well as the healthcare system as a whole, to step in with initiatives and programs, training and education to upskill ourselves and work together as a multidisciplinary team to improve this landscape. And specifically, early detection, screening, and prompt treatment in a team-based format of all non-communicable diseases, as well as palliative care, are key components of the response to NCDs. In addition, there's specifically an opportunity and a need for oncology pharmacists in this space to professionally develop and grow and to become valuable members of the cancer care team. A main reason for this, as you can see here on this slide, is the growing number and depth and type of treatments that are used in the oncology space. So in addition to radiation therapy and surgical interventions, there are many different types of pharmacologic treatment modalities in cancer. Traditionally, this was previously mostly in the cytotoxic space, where these medications target rapidly dividing cells, and as we all know, also can affect other cells and therefore lead to a lot of the side effects associated with these medications and the need for so many supportive care interventions. Since the invention of cytotoxics, there have now been many additional classes of therapies that we use in our approach against treating cancer, and these include immunotherapy, which uses the immune system against cancer, specifically things like monoclonal antibodies, vaccines, and cellular therapies such as CAR-T. Also targeted therapies, which target specific proteins that are required for cancer cell growth and survival. And finally, endocrine therapy, which blocks or changes the amount of hormones to slow down or stop the growth of cancer. So in light of all of these many different types of classes of medications and growth in these classes, this combined with many other advances in the field of oncology make it a good time for pharmacists to upskill themselves and like I said, really participate in the multidisciplinary care team to improve the lives of patients and the quality of their care. Some of the other trends in oncology related to this are, I already mentioned the new treatment classes, specifically things like checkpoint inhibitors, CAR-T, and targeted therapies. As a result of all these multiple options, we now also have much more opportunity to tailor therapy for patients' specific tumor molecular profiles, characteristics, and preferences, personalize their therapy to be more targeted towards their specific cancer. Pharmacists can also play a very big role in monitoring for adverse effects, as well as encouraging patients to adhere to their therapy and stay on the schedule, motivating them and encouraging them to stick with their treatment. There are also a growing role for biosimilars, which are also a very important component of cost-effective care. And shifts in site of care are starting to become more common, where patients who traditionally had to come to the hospital for all of their care can now receive some care in the outpatient setting at clinics, or in some cases, even in their home. Especially as a result of the pandemic, we've seen a growth in the availability of telemedicine, which again allows clinicians and the team to provide care to patients in a way that's more convenient to them and more accessible. And this is all enabled also by digital tools and advances in information technology. In addition to systems being more integrated, they're also now more portable. We all have tablets and cell phones and can access a lot of information in new and easier ways. And this can also lead to benefits in communication with patients. For example, there's an increased ability to collect patient-reported outcomes, where patients can report back what's happening with their symptoms, their side effects. If they have any questions, communication is now easier between patients and the care team. There's also, as a result of the availability of electronic medical records, more availability of real-world data to be able to collect and analyze and assess trends and opportunities for improvement. Now looking at some of the trends in oncology pharmacy specifically, I already mentioned this a little bit, but to focus on it some more, there's a greater emphasis now on multidisciplinary team-based collaboration. Oncology is definitely a team-based discipline where everybody brings something different to the table, and it's imperative to support patients with all of the different disciplines and skills that we all have. There's oncologists, there's nurses, there's pharmacists, there's dietitians, social workers. Everybody working all together can improve the lives and the quality of care for our oncology patients. Pharmacists also have been gradually over the years broadening the scope of our clinical services because we are the medication experts. We can provide our expertise and our knowledge to help in the treatment decision-making process, as well as in the timeframes after patients start on their chemotherapy to help with their management, their supportive care, making sure they understand their treatments and providing reinforcement, encouragement along the way. Pharmacists can also be accountable for medication management, in addition to the monitoring and the adherence. And we have an increased role more and more in direct patient care as well as patient education. And finally, I think pharmacists are also integral to larger scale improvements in the quality of care. And this can be things like working on guidelines, policies, standards, and clinical pathways at multiple different levels, including your institution, or also on national and international levels, for example, such as this program. And since we are today focusing on oncology pharmacist roles and activities, I wanted to also mention some more detail about opportunities for oncology pharmacists and pharmacists who are maybe interested in learning more and becoming more involved in the area of oncology. The good news is that there are so many different types of opportunities in oncology. It's a very broad field with a lot of different opportunities for involvement. And perhaps the most recognizable role for a pharmacist is to integrate into the multidisciplinary healthcare team and work to optimize patient care through activities such as attending rounds and patient appointments in the clinic. Pharmacists can review reports and lab values, help provide drug information, and assist in making treatment and therapy decisions for both the cancer as well as supportive care, and also review new orders, verify appropriateness of therapy, indications, and dosing, and then monitor the result of those treatment plans and recommend strategies to address drug interactions, adverse effects, and also encourage adherence. As I mentioned, pharmacists have a huge role in supportive care management, specifically because the adverse effects from cancer treatments can be so common and in many cases very severe. So the more that we can help with prevention and improving the quality of patients' lives, the better and more likely they are to have positive outcomes. And pharmacists can provide many recommendations for nausea and vomiting, managing neutropenia, helping with pain and mucositis, and many more. And finally, pharmacists also have the skills to navigate many of the logistical and procurement issues for specialty medications. As we saw in the earlier slide, there's more and more medications, and they all have sometimes different ways of obtaining the medication and logistics involved in planning and storing and procuring these medications, and pharmacists can have a big impact in that area. Again, as the medication experts, pharmacists can also provide counseling to patients and their caregivers so that they understand their therapies better and know what to expect. That sometimes makes it much less intimidating to be on their therapy. And pharmacists can also provide education to the multidisciplinary team and work to improve the quality of medication management and, as I mentioned, overall policies that can also help improve the quality of care at different institutions. In addition, some other pharmacy roles for oncology pharmacists are in the realm of practice management. And again, with these specialized medications, also specialized handling comes along with that. And so pharmacists can work to manage policies and practices at their institutions to ensure appropriate storage, handling, preparation, and dispensing of these medications, which can often be hazardous and have specific handling requirements. And pharmacists are very well suited to help manage that. As I also alluded to, pharmacists can have a role in developing policies and SOPs for optimizing all things that are medication related, including safety, quality, efficiency, and even cost-saving opportunities. And finally, pharmacists can also have contributions in the oncology research space and quality improvement initiatives. There are many oncology clinical trials available, and pharmacists play an integral role in helping to manage investigational medications, their handling, their dispensing, and again, counseling and education, all the roles we talked about previously, but in the space of investigational medications. And so participation in oncology related research can be, in many cases, a focus for pharmacists as well. So as I mentioned, there's a wide variety of activities that pharmacists can take on in the oncology space. And as a result, there's a lot of different types of oncology pharmacist positions. And in many cases, these are not even neat boxes on their own. Sometimes somebody's role may cross multiple areas that are listed here on the slide. But in general, and this is based on a scope of hematology oncology pharmacy practice document from HOPA, which is the Hematology Oncology Pharmacy Association here in the US, some of the key types of pharmacy positions are listed here. Again, the most recognizable is probably the clinical or specialist oncology pharmacist, and this is the pharmacist that works either in the inpatient or ambulatory settings or both, and they may either have a tumor-specific focus or a general oncology focus where they're working with the multidisciplinary team on a daily basis, attending rounds or patient visits, making recommendations for treatment and supportive care, and really having an integral role in that day-to-day care of patients. There are also infusion center oncology pharmacists who are typically more involved in the sterile compounding of anti-cancer treatments. They work typically in the pharmacy and the infusion center, either mixing or supervising technicians, making sure orders are properly verified and have all of the appropriate and correct information, that dosing is appropriate. It's a very integral role. And again, with some of the advent of newer therapies, there are now an increasing number of specialty pharmacy oncology pharmacists. And these are folks who are involved in the distribution and dispensing of oral anti-cancer treatments. And it may be a standalone pharmacy or in connection with a hospital pharmacy, where pharmacists are making sure, again, to do that appropriate prescription review, dispensing, lots of patient and caregiver education in this role, and also counseling and follow-up is key here too, especially if patients are taking medications orally at home. They need that extra support to help recognize particular side effects, when to call and report certain changes and certain side effects. This role is very integral to that. On a larger scale, bigger picture type of perspective, there's also practice management oncology pharmacists. And these are folks who provide leadership and oversight for whole departments, perhaps, and lead a smaller group of oncology pharmacists. They may have involvement in coordinating standard operating procedures and administrative issues, just making sure that the oncology pharmacy department as a whole is functioning smoothly and forward-thinking. Mentioned the area of investigational drug services, and these pharmacists typically coordinate pharmaceutical services related to oncology drug studies and clinical trials. And then in addition to these kind of primary roles, there are many, many alternative roles. So lots of opportunities for pharmacists in oncology, specifically in the setting of academia, things like medical communications, even population health, and also increasingly now informatics as well. And finally, just wanted to close by emphasizing the value and impact that oncology pharmacists can have on clinical services and programs. There are many publications that describe activities and programs implemented by pharmacists. And so this is just a select few that come from a publication recently that summarized some of the major publications in these areas. But for example, pharmacists, again, they're medication experts. They can have key roles and impact in things like patient education for anti-cancer treatment plans, which helps increase the quality of patient care, as well as their outcomes and their understanding of their treatments, as well as their satisfaction with their care, because they're more of an active participant who understands what to expect. Pharmacists can also help with increasing and encouraging adherence by conducting regular follow-ups and providing education on the importance of regularly taking their therapies on schedule. And this improves the overall quality of care. I mentioned some of the opportunities for standardization, and by implementing things like chemotherapy regimens in a standard order set or protocol fashion at your institution, these can help reduce things like medication errors, improve efficiency of ordering medications, as well as standardizing the quality of care so that, again, it's just easier to access and easier to standardize the ordering of chemotherapy. There are also examples of dose banding or dose rounding programs, which help to save cost as well as reduce waste by banding or categorizing the rounding numbers for chemotherapy or doses. And this can also help with efficient preparation as well as reducing patient waiting times for chemotherapy. And finally, there are also more advanced roles for pharmacists in collaborative practice agreements, where they can work together closely with an oncologist at their practice to help provide supportive care, both pre-medications as well as helping to manage adverse effects as they arise, as well as their monitoring. And this, again, overall improves quality of care, outcomes, as well as decreases physician time because they're able to work in partnership and frees up some time for physicians to spend on other activities. And again, more support and monitoring for our patients and improving the quality of their care overall. So in summary, it's an exciting time to be an oncology pharmacist and to be learning about oncology. There's a lot of room for impact and value here. So I'm looking forward to the rest of today's presentations and everyone learning more about the handbook and the knowledge and skills guide. And ISOP is very proud to partner with FIP on this event today. Thank you.
Thank you very much, Evelyn, for your brilliant presentation and for showing us the oncology pharmacist opportunities. There are many opportunities. Also the pharmacist roles and activities and how they can contribute to better cancer care. Thank you so much. If you have some questions, please leave your questions to Evelyn in the Q&A box. Now, our next speaker is Dr. Folakemi Odedina, who will talk about the pharmacist involvement in cancer and cancer management and in diversifying clinical trials participation. Dr. Odedina is professor of oncology. She is the Enterprise Deputy Director for Mayo Clinic Comprehensive Cancer Center Community Outreach and Engagement, Site Director for the Center for Health Equity and Community Engagement Research, CHCR, in Florida, and Director of CHCR Global Health Equity Program at Mayo Clinic. Also at Mayo Clinic, she is a member of the Mayo Clinical Trial Strategy and Governance Leadership Team and leads the Community Engagement Health Equity Clinical Trial Strategy. Her research program focuses on the predictors of cancer health disparities and cost effectivity, community-based behavioral interventions to improve the health of minority populations, especially Black men globally. Professor Odedina is personally and professionally committed to eliminating cancer disparities, especially in people of African ancestry. Thank you very much for being with us today. Over to you.
Thank you so much. It's such a great honor to be here and such really excited to see the amazing group of pharmacists in different areas across the world that are gathered today to listen to this webinar. I have to tell you, so my first degree is in pharmacy and I have a PhD and now I'm a pharmaceutical scientist. So you could technically say I'm one of those investigational pharmacists that really focuses in the area of research alone. So what I'm going to talk about today is pharmacist involvement in cancer management, as was said, and really honing into clinical trials participation, because that is the area of passion that I have. But I want to say, thank God, thank you to the very first speaker, because she has really done an absolute wonderful job in honing it into the micro level of oncology pharmacists. I would like to take a much more broader level, because it's not everyone that is an oncology pharmacist, especially in the low, middle, and income countries. There are pharmacists who can have the right expertise and still contribute to addressing the burden of cancer globally. So I will I'm going to take that level of broader perspective. So this is the learning objectives. I'm going to focus on the very first one, talking, like I said, on a more macro level, on the role of pharmacists in prevention, screening, care, and management of cancer. So I just sort of wanted to take a look. I love this article by McCall that really talks a lot about role of pharmacists. And I wanted to say from somebody, who really was part of the movement for pharmaceutical care in the early 90s and worked very closely with Charles Hepler and did a lot of research on the role of pharmacists in pharmaceutical care. I am really very pleased to see that the role of pharmacists keep improving, right? So we have pharmacists who can have roles in value-based models. We have pharmacists in primary care gaps, patient care activities, training and education, having high level of trust, and also could be part of supportive technology as well. This is all the things that but it really sets the stage for understanding why it is time and why pharmacists can have expanded role in cancer care. So when you take a look at it, other providers who are not pharmacists strongly agree to primary care employment and role of pharmacists in disease specialization. When you take a look at pharmacists responded, pharmacists are ready. They really are thinking about themselves in different roles that actually include disease state management as well. And then when you take a look at what consumers are saying, they have the right comfort level for pharmacists to be in the area of cancer care. They trust us to do so many things, including diagnosing conditions, including medication therapy, including management of chronic conditions. And of course, the trust level of pharmacists is really high. This is preaching to the choir. You already know this, but I wanted to sort of talk a look about it. So you may be a pharmacist who is not necessarily an oncology pharmacist, right? So the question is, do you still have a role to play in cancer care and control? Absolutely, yes. Pharmacists have a significant role to play across the cancer care continuum. And the cancer care continuum goes from prevention to screening to diagnosis to treatment and to survivorship. This is really the uniqueness of being a pharmacist. We do not have to box ourselves in one area. We have broad range of expertise. We have broad range of skills, responsibility, and practice from being in the community, which is really, really very important, to really being in the hospital and to actually even being a pharmacist scientist. So I would actually pose it to you as a pharmacist. We can go from molecule to the community and have an impact in cancer care. That is the role that we can have. So the scope of oncology of pharmacy practice, he has pretty much been very well summarized. I'm not going to focus much about it, just kind of emphasizing that it's very broad. And pharmacists have a huge scope in inpatient oncology pharmacists, as described, in ambulatory oncology pharmacists. And you can see how these roles kind of move from working closely with other healthcare providers to the coordination of chemotherapy, to medication therapy management, to being part of a collaborative practice that is really very significant. You can actually see pharmacists in decentralized oncology pharmacists, as well as specialty oncologists, as discussed, including practice management, as well as investigational drug pharmacists. But now, let's kind of think about it. I want to pose to the idea that we do have a role across the cancer care continuum. From prevention, think about this is where pharmacists can really have a really good impact. If you're thinking about prevention of cancer, risk reduction of cancer, making sure that people are really focusing on their health, community pharmacists, retail pharmacists, pharmacists across different practices, they have access to patients to be able to provide patient education. So you can do one-on-one, but in addition to that, pharmacists can have an impact in prevention and screening, but also doing community outreach and engagement. I get excited when community pharmacists actually get together and they go into communities, especially in underserved communities, in minoritized communities, in marginalized communities, and they put up a community outreach and engagement that could actually talk about cancer prevention, that could talk about risk reduction, that could talk about the things that really impacts the lifestyle that leads to cancer, like obesity, like diet, like exercise, and things like that. Those are areas that I feel very strongly that pharmacists can also have a role. In the area of diagnosis, as part of a collaborative practice, pharmacists are able to do assessment and diagnosis. For treatment, this is the area that we are most known for, right? From treatment decisions to compounding and dispensing of chemotherapy, to maintaining supply of drugs, patient education, patient care, minimize waste and exposure to hazardous drugs, managing cost and reimbursement. I just want to pause for a minute and kind of think about how pharmacists can have a significant role in the financial toxicity that is linked to cancer. This is the number one area that is significantly impactful. A lot of cancer patients, especially from LMICs, even when you're talking about developed countries or high income countries, patients who are part of marginalized communities or who are part of minoritized communities, cancer can really deal a huge blow to them. This is an area that we can help by managing their drugs, by taking them through programs that can be linked to pharma for them to get drugs in the reduced way. So medication management and the area of managing costs and reimbursement is really, really very key. The final part of the cancer care continuum is survivorship. And that is when you're thinking as you enter into this area and cancer patients are really receiving their treatment from survivorship care. And survivorship covers, everything all the way to the end of life, right? Critical area for community pharmacists to really assist and support cancer patients in symptom management, in supportive care, in hospice care. I have outlined adherence to survivorship plan. One of the things that is really a gap when we're thinking about cancer patients and cancer survivors is this survivorship plan, where if you are a cancer patient, one of the things that really, really helps you to really be able to manage as well as prevent other cancers, as well as prevent recurrence, as well as ensure that you're being managed appropriately, is survivorship plan. But a lot of patients or cancer patients do not even have a higher education or do not know how to do this. Pharmacists are consistently in contact with cancer patients, and so this is an area that pharmacists can also have a huge impact as well. I've already talked about management of cost and reimbursement to address financial toxicity. So when you think about it, right, when you think about it, we do not only see, I've been, as the person, enterprise-wide deputy director for the Mayo Clinic Comprehensive Cancer Center, I see the whole continuum of cancer occurring. And I think one of the things that is so important, pharmacists is one of the only practice that I know that wherever you are practicing, whoever you are, from being an investigational pharmacist, to being in the hospital, to being in specialty care, to being in the community pharmacy, you have a significant role to play in cancer care and management. And I think we need to think about that, right? So additionally, we need to think about the fact that pharmacists can have a really great impact to be able to work collaboratively with other providers, providing guidelines, policies to improve quality, safety and efficacy in the area of education, training, and mentoring. This is really key. One of the things I'm very passionate about is training the next generation of scientists. So pharmacists need to be thinking, as we expand our role, we need to take on this education, training, and mentoring, not only of pharmacy workforce, but other healthcare providers as well. We also need to think about this unique opportunity to be able to educate patient caregivers and advocates who can be layperson to support cancer patients or to support prevention and to support informed screening within the communities as well. Really very unique position that pharmacists find themselves, and we can either see ourselves. Other areas that is the expanding role of pharmacists is, I've listed is stem cell transplantation, hematology, gastrointestinal oncology, and also precision genomics. And precision genomics is such a specialized area that I think, one of the things that is going to be an area that we are going to continue to make huge impact. So thinking about that, while it is so critical that pharmacists see themselves across the continuum of cancer care, right, and it's not only in the specialized area of oncology pharmacy, we can make a difference. I really want to say that my passion is pharmacists' role in clinical trials diversity. And we have seen how pharmacists really have unique role in clinical trials from what we just kind of went through and are still going through with COVID-19, right? Pharmacists are in such a position to really make a huge difference in this area. And I just kind of want to think about it. When I was invited to give this talk, my very first response is, yes, I will do it, but only if I'm allowed to do a call to action that really have a uniqueness in how pharmacists can address clinical trials diversity. There is a lack of representation of minoritized and marginalized individuals in clinical trials, which really is leading to health disparities and leading to cancer, the significant burden of cancer worldwide. Whether you are in the United States or in a high-income countries, when you're even speaking of low middle-income countries, it's even worse. So on the bottom, this is the report from our US FDA, and you can see that minoritized communities are really underrepresented. But the gap is even much more wider when you look at the global platform. For everybody who's in here, I'm so pleased that we have a lot of people across the world. You can take a look at where you are, and this is even for all diseases, all infectious diseases. When you take a look at the one for clinical trials, it's even worse. So we literally have disparities in the area of clinical trials participation. I want you to think about it. As pharmacists, we know that clinical trials is the gold standard for us to develop therapies and interventions that are tailored to those populations. This is one of the reasons, especially in low, middle income countries, and I do a lot of work in Africa, we are seeing that the cancer therapies that are in there, right, they are not working appropriately, right? It is failing. Some of them are failing. And that is because these drugs, this therapy were not really developed with those populations represented in the clinical trials. So I really want to kind of think about it. I love the Clinical Trials Transformation Initiative, and I'm going to talk in a minute about how we can see ourselves as pharmacists in being able to diversify clinical trials, especially cancer clinical trials. The Transforming Trials 2030 talks about patient-centered clinical trials, easily accessible to all, fully integrated into health processes, designed with a quality approach, leveraging all available data and improving the population health. I really want to pose a question to you. Of all the professions that you know, which professions has the most access to the populations, whether patients, whether healthy? It is the pharmacy profession. It is the pharmacy profession. And so we have an opportunity to really transform the diversity of clinical trials. And one of which areas that we now know, which even has much more implications for the profession of pharmacy, is meeting patients where they are. It is the decentralization of clinical trials. We now know that one of the problems why we have really lack of representations in clinical trials is because it is very difficult for minoritized, marginalized patients or patients who are in LMICs to be able to get to those clinical trials. So there's this wave of decentralization of clinical trials that is coming up where we have to use technology-based human clinical trials that utilizes telemedicine and mobile or local healthcare providers to gather data and which differ from the traditional design. And so you can see from here, there's the fully centralized, there's the fully decentralized. And the fully decentralized even means that we can have minimal risk trials taking place in community pharmacies. In the community, you think about it, the most accessible and most trusted profession is pharmacists, right? And highly accessible because they are present in minoritized and marginalized communities all over the world, even in Africa, where you cannot find, because I work a lot in Africa, where you cannot find a hospital for miles and miles and miles. You have a medicine store and you have a clinical trial. So meeting patients where they are becomes very important ways for us to be able to do this work. Highly beneficial, faster trial, improved retention, improved participation, greater control, increased participant diversity, which is the huge thing. So these are the opportunities. I just kind of want you to see this. Wherever you're practicing for the, over 200 people who are currently watching us and for the thousands of people who are going to rewatch this, I really want you to see what decentralization means. And I want you to see yourself in being able to have a role in cancer clinical trials. So from technology, e-consult, e-diaries, video, remote monitoring, digital measurement, we can work with pharmacists in the community to be able to have a way to use technology to take clinical trials to people. from the processes, home health, local lab, local imaging, drugs applied to the home, right? From enable visit and non-traditional means. Look at pharmacy was mentioned. So we can do a Mayo Clinic, one of the things that we are really working on is decentralization of clinical trials, including trials at home, but also including partnering with pharmacists to be able to have minimal risk trials in pharmacies as well. So I want to end by saying if you have not listened to anything that I said, yes, I really appreciate it. Pharmacists have a huge role to play in the area of cancer care across the continuum. I also want to emphasize that we can be champions to diversify clinical trials. And so we are ready. Mayo Clinic Cancer Center is ready to really continue this dialogue with FIP as to how can pharmacists across the world be involved in decentralization of cancer clinical trial to be able to ensure that all cancer patients have access to clinical trials as well as their cancer care and control. Thank you.
Thank you very much, Professor Adedina, for your brilliant presentation and for showing us the pharmacist's role in cancer care continuum, the prevention, screening, diagnosis, treatment, and survivorship, and how can pharmacists be involved in clinical trials, especially the opportunities for pharmacists in the clinical trials decentralizations. I want to highlight from Professor Adedina's presentation the important message that pharmacists, even if do not have a specialization in oncology pharmacy, they can have a very important role in cancer prevention, screening and management. Once again, thank you very much, Professor Adedina, for your time and your presentation. Next, I have the pleasure to present Matthew Ang. Matthew is a clinical staff pharmacist at an urban community teaching hospital in Montreal, Canada. He obtained his Doctor of Pharmacy in 2018 and subsequently completed his residency training and Master of Science in Advanced Pharmacotherapy. His main area of practice is in critical care. Matthew is also passionate about global health systems, and pharmacy education. He currently consults for FIP in practice development, and he is the soul of the Cancer Care Handbook. Over to you, Matthew.
So thank you very much, Ines, and good day, everyone. It's a pleasure to be here to introduce the handbook on cancer. If you could just go forward with the slides, please. Thank you. Right. Yeah, so today I'll be presenting this new handbook that we've developed on cancer care. Before going directly into the handbook, I wanted to take a few moments to really talk about what has been achieved so far regarding the fight in NCDs. And this is something that our wonderful moderator has spoken about at the beginning of the presentation. But in terms of FIP, FIP has reiterated its advocacy for pharmacists in non-communicable diseases, so from statement of policies and different guidance documents. And this is also in parallel with different work that's been achieved by different global health organizations across the world as well, such as the World Health Organization. So really putting forward the pharmacists thanks to our expertise, our accessibility, and as integral parts of the healthcare team, and as essential players in decreasing the burden of non-communicable diseases. So as was mentioned, in terms of the Practice Transformation Program on non-communicable diseases, so far 3 handbooks and their accompanying knowledge and skills guides have been published. So the first one on diabetes, the second one on mental health, and the third one on chronic respiratory diseases. So this fourth one on cancer care is sort of inserting itself as part of the Practice Transformation Program, with the last one being on cardiovascular diseases that will be released in a few weeks as well. As my colleagues have mentioned, cancer continues to be an important disease. It's a leading cause of death and associated with approximately 1 in every 6 deaths in 2020. And some calculations have been made to sort of estimate what would the total cancer cost worldwide would be, and they're estimated to be greater than $1 trillion US dollars. And this statistics actually dates back from a few years. So up to now in 2022, those cancer costs are expected to have likely, be a lot greater due to a variety of factors, but could be also including the emergence of novel therapies as well. So in light of all of this, FIP developed a new handbook on cancer care to really support pharmacists and their organizations in providing a whole range of cancer-related services, and had the pleasure of leading the authorship of this handbook as well. So it's accompanied by a knowledge and skills guide, which my colleague, Dr. Dalia Badges, will be presenting shortly afterwards, and was also developed with the contributions of really a expert advisory group with a broad range of experiences and backgrounds who are really able to help us and enrich the publication as well. We also made efforts to make links to different FIP references and guidance documents that are already existing. So you can consult them on the FIP library, but we also wanted to sort of refer to them throughout the handbook. And then finally, we wanted to illustrate, and give examples of different interventions that pharmacists could make. So we came up with a few fictional case examples throughout the handbook as well. So as mentioned, the handbook and the knowledge and skills guide will be officially launched next week on October 12th. But during this presentation, I'll go over a brief overview of its contents. So in terms of the handbook, we separated it by types of intervention. So we begin by a background, then we look into prevention, screening and early diagnosis, management and treatment optimization. And then we finally end the handbook with a section on additional considerations to keep in mind when providing these types of services. So we'll go over each of these different sections, and I'll present to you what's in the handbook exactly. So for the first chapter of the handbook is on the background. So really in this chapter, we present some contextual concepts that are useful as sort of, foundations or backgrounds when providing cancer-related services. So we go over definitions of cancer, as well as look at commonly used systems in terms to classify, grade, and stage cancers. We also look at sort of the prevalence and impact and really the burden of cancer as well. And then we go over a brief overview of different services that are possible when led by pharmacists with regards to cancer care. And finally, we end with a few reflections on the importance of a multidisciplinary approach when dealing with cancer care and providing care to patients affected with cancer. So as you can see on the diagram on the right, I apologize if the font is a little bit small, but we can see the main takeaway message is that the patient is really at the center of the care that we're providing. We have all of these different healthcare professionals and members of the healthcare team who are gravitating toward all around the patient. And really, our objective is really to provide as much patient-centered care as possible. And because cancer is a disease that's so complex, and because it does have repercussions, on patients and their close ones, beyond physical health, the importance of a multidisciplinary approach in this area cannot be understated as well. So that's what we had here for the background chapter of the handbook. Next, we went on to describe prevention. So it's estimated that up to 50% of cancers can actually be prevented. So I think this really sheds light on the opportunity that we have as pharmacists to implement different prevention strategies and to utilize the proximity we have with patients and the relationship of trust that we have with them as well, in order to sort of help them, implement different lifestyle interventions that can be made into their daily lives to, yes, possibly prevent the development of cancer, but also for their overall health as well, and to prevent other non-communicable disease development as well. So in this chapter, we identified a few key areas for cancer prevention, and they're likely already familiar to you because they're perhaps key areas that you're already working on or that you've already implemented in your clinical practice. But all of these have been identified as key areas to help prevent cancer. And so we related them with regards to cancer in the handbook, and we detailed a little bit of information on how these prevention strategies could be implemented. So we look at nutrition, alcohol consumption, weight management, and physical activity. We look at smoking cessation, air pollution and occupational exposure, exposure to sunlight and ultraviolet radiation, safer sexual practices, and vaccination. So these are all areas in which we as pharmacists can really make impacts and help reduce the development of cancer. And then the following chapter focuses on early detection services. So we look at screening and early diagnosis as different services that could be implemented as well. In this chapter, we'll discuss risk factors, and we'll also discuss conditions for successfully implementing effective screening services as well. And different guidelines on specific cancers are introduced. So we'll look at cervical cancer, breast cancer, and colorectal cancers as well, to just provide a brief overview of different screening guidelines that are available as well. What's interesting, particularly about screening services, is that there's a good amount of data literature that have been published regarding pharmacy-based services with regards to cancer screening. So we thought that it was important to describe these different services. So there's colorectal cancer screening programs and a skin cancer screening program that have already been published. So these are things that if you're interested in, or you could look at it in the handbook, I think that it's a good opportunity to perhaps draw inspiration if you're looking to implement a similar service within your own practice. So you're more than encouraged to look at the handbook and look at the references that we've cited as well on real life on the field examples of different pharmacy-based screening services that have been implemented already and that have had benefits as well. And then we move on to the chapter on management. So for the first part of the management chapter, we'll visit the clinical and therapeutic aspects of cancer management. So we'll go over the clinical presentation of cancer, as well as methods used to diagnose. And then we'll look over the different treatment options. So of course, we'll have the pharmacological treatment, where we'll look at examples of different agents that are available, as well as provide a brief overview of the associated safety profiles. So we have hormonal therapy, chemotherapy, targeted therapy, and immunotherapy. And then we'll also discuss additional treatment options that are not necessarily pharmacological, but things like radiation therapy and surgery as well. And the next portion of our management chapter, we present some practical considerations with regards to providing pharmaceutical care to patients with cancer. So we'll really, reflect on some key points when providing, the most optimal care possible to patients affected with cancer. So we'll provide some guidance or some reflections on assessment of the effectiveness and safety of treatment plans, on the evaluation of the risk of interactions, on the monitoring of medication adherence, and as well as on considerations on the cost and supply of oncology medications, which sometimes can be quite complex as well. This was already alluded to as well by my colleague, Dr. Handel as well, but oncology medications, may pose, risk for contamination and accidental exposure, and therefore the handling and storage and disposal of cancer medicines is quite specific and may require lots of different steps. So we thought it was important to include a section on this as well. We largely base ourselves on a guidance document developed by ISOP actually. So you're also encouraged to view this reference as well. And then sort of the last chapter that we had on types of interventions is with regards to treatment optimization. So in this chapter, we describe the management of adverse effects and complications that are associated with cancer treatment. We begin by a brief overview of adverse event terminology and classification, and then we provide some examples of commonly encountered adverse events and complications, describe a little bit of how they occur, as well as describe some pathways with regards to how to manage them. So we look at things like mood change and fatigue and nausea and vomiting. And in terms of complications, we look at some of them like tumor lysis syndrome, febrile neutropenia, and immune-related adverse effects. And then finally, we end the chapter of treatment optimization with a few considerations regarding fertility preservation and specific populations, so namely obesity and pediatric populations as well. And so at the beginning of this portion of the webinar, I mentioned that we included some fictional case examples to sort of illustrate the types of interventions that we can make. So this is a portion of a fictional case example that we included with regards to treatment optimization. So it's not the whole case example, just a few sentences, but hopefully it'll help you understand sort of how an example of how pharmacists can contribute in this area. So it goes as Lee is a pharmacist working in a community pharmacy located beside a busy cancer center. He receives a prescription and realizes that no as needed or supportive antiemetic medicines were prescribed. And when interacting with his patient, he notes that the patient had a significant history of nausea and vomiting during her pregnancies. And then when Lee sort of goes to assess the treatment plan and the prescription, he also notices that the patient was undergoing a chemotherapy regimen with a high potential for nausea and vomiting, which makes the patient at risk, at an increased risk for nausea and vomiting. So he decides to collaborate with the oncology pharmacist at the hospital, who's able to independently prescribe supportive care antiemetic medicines. And then the patient is finally able to receive her antiemetic medicines and hopefully not experience significant adverse effects from her cancer treatment. So all in all, our intention with these fictional case examples is to really give a real life scenario of how pharmacists can assess different situations, collaborate with patients and with other members of the healthcare team to really provide optimal cancer care for their patients. So you'll be able to see the details of these fictional case examples in our handbook that will be released next week. And then our last chapters with regards to additional considerations. So just a few other key points that we thought was important to discuss when providing cancer care services to our patients. So we discuss the role of the pharmacist in cancer prognosis and end-of-life care. We also spend a brief moment to look at transitions of care and the important role of the pharmacist when reducing medication-related harm at transitions of care. We'll go over certain barriers and challenges to implementing these services, as well as presenting different service models that exist as well. We'll provide a brief overview of training, knowledge, and skills, as well as genetic testing. And then finally, we'll end with a few notes on clinical trials, pharmacovigilance, and the role of electronic health and mobile health in cancer care. We also end the handbook with a few key resources with regards to information on oncology or cancer care in general. So some of these you may already notice, different organizations worldwide that really publish reputable, evidence-based data with regards to cancer care. So you'll be able to find all of that in our handbook as well. So to finish off, well, the handbook that we've developed discusses different aspects for pharmacist-led services across really the continuum of cancer care. So as we've mentioned, starting from prevention and early detection to management and treatment optimization. So we're able to count on the input of our expert advisory group. We're able to make references to different FIP documents that are published and that are in relation with different aspects with regards to cancer care. And finally, we attempted to illustrate different interventions using fictional case examples. So we believe that our handbook is going to be useful and relevant for a wide range of pharmacy stakeholders, from frontline pharmacists to leadership staff as well. And along with the knowledge and skills guide, we believe it'll be useful tools to sort of helping to build the pharmaceutical workforce and sustain their presence and their work with patients who are affected with cancer as well. And finally, before I finish off, I just want to take the time to acknowledge a few key individuals, like I mentioned before, who were really pivotal in developing this handbook. So we have Amira, who's FIP volunteer who collaborated in the authorship of the handbook, as well as members of our expert advisory group. So Claire Alshebli, Assistant Professor Kovacevic, Dr. Kofi Mensah, Dr. Odedina, Dr. Skellen, and Irene Rue as well. So as you can see here, an expert advisory group that's rich in expertise and backgrounds and experiences as well. And finally, we also wanted to highlight the collaborations with these two organizations. So of course, the Dr. Handel and the International Society of Oncology Pharmacy Practitioners, as well as the European Society of Clinical Pharmacy. Great, so thank you very much for your attention.
Thank you very much, Matthew, for your work and for presenting us this amazing tool. FIP trusts that this resource will contribute towards advancing the role of pharmacists in the prevention and management of cancer around the world. I hope you enjoy this handbook. Our last speaker is Dalia Badges, that will present the Knowledge and Skills Reference Guide for Professional Development in Cancer, a companion to the FIP Cancer Handbook for Pharmacists. Dr. Dalia Badges is the FIP lead for provision and partnerships, and she is the soul of the KNS guides. Dalia comes from a background in pharmacy practice and academia. She is a registered pharmacist in Australia and has a PhD in pharmacy education and training from the University of Sydney. Thank you very much, Dalia. The floor is yours.
Thank you so much, Ines, and good afternoon or good evening to all of our participants on the call. It's an absolute pleasure to be taking part in this live webinar. I would really like to take a moment to thank our previous speakers for providing such insightful and also inspirational feedback on the pharmacist role and services that can be provided by pharmacists in the area of cancer care. And if I could just take a moment of reflection on what Professor Odidna and also Dr. Handel have already shared, they really highlighted the importance and the value and impact of the pharmacist role on a continuum of services in the area of cancer care. As Professor Odidna already said, from molecule to community, I will take this one further, a block away from this, and go policy development, advocacy on an international level. And this is exactly what brings us all together on FIP's international platform for all of our colleagues and partners that work in this particular area and other areas across the non-communicable diseases spectrum. Taking the pharmacist role from molecule to community to advocacy and policy making on an international level really highlights a spectrum of roles going from prevention all the way to survivorship, as was described by our previous speakers. So this staggering, I think, display of avenues where pharmacists can really intervene has really come home to me. And I hope that that can also come home to many of our participants on the call and colleagues today. It's my pleasure to be involved in this project to present the companion reference guide in the area of cancer care that we worked hand in hand with the developers of the handbook on as well. Before I go any further, I'd like to acknowledge the contributions from my colleague, a pharmacy student from the United States, Amira Mustafa. Amira is a third-year PharmD student at the University of North Carolina, Eshelman School of Pharmacy. She participated in this project in the capacity of a FIP remote intern and supported the development of the Cancer Handbook and Knowledge and Skills Reference Guide as well. Amira hopes to work in the global setting to advocate for medication access for underdeserved populations. So thank you, Amira, for your contribution in the development of the Knowledge and Skills Guide. Amira is actually with us on the call today, and she's more than happy to say hello to you on the chat, and perhaps if you have any questions in relation to this publication. So I'd like to acknowledge that we have worked hand in hand with the development of the FIP Cancer Handbook for Pharmacists in the area of cancer care. This is a companion publication that was developed to support pharmacist professional development in the area of cancer by identifying knowledge areas and skills needed to provide services and fulfill some of these roles that were described by our previous speakers. This guide will act as a continuing professional development guide to providers as well in the area of cancer care, but also will provide or expand on the full potential of pharmacists in the delivery of services and responding to the needs of people living with cancer. I'd like to walk you through the development pathway for this knowledge and skills reference guide, as we have done with previous knowledge and skills reference guides, as my colleague Ines highlighted earlier, and Matthew, that the reference guide in the area of cancer is the fourth in a series so far. We've already got one on diabetes, we've got one on mental health, and last week we launched the reference guide with the handbook on chronic respiratory diseases. So a lot of the work that goes into it is underpinned by existing international guiding documents and guidelines and standards, some of which have already been launched or released by the International Pharmaceutical Federation, FIP. And one of these handbooks or resource is actually the Beating Non-Communicable Diseases in the Community on the contribution of pharmacists in the area of NCDs. And so these really underpin a lot of this work. And so we identify some of the key roles, services, or interventions that can be provided by pharmacists and combine this by a literature consultation. And finally, we go to our expert panel, our advisory group of experts in the area of cancer, to consult them for a thorough revision of the compilation of knowledge and skill statements that we have brought together. And this really has been our methodology to develop the reference guide for pharmacists. I would like to also highlight, not only have we come up with a compilation of statements and categorize those in different knowledge areas, as you can see on the screen, but we have really tried to align with the competency clusters that are presented in the FIP Global Competency Framework. And these really link then with four main clusters in the area of pharmaceutical public health, pharmaceutical care, organization and management, and finally professional and personal competencies. You would have heard some of these already reiterated by our previous speakers. And so once you have a look at the reference guide, you will see how the knowledge statements and the associated skills have been categorized accordingly so that our publications talk to each other, they make sense to the reader and the user, so that you can see how they link to overarching competency clusters. And in the pyramid on the slide there, you will also see that the different topics are actually color-coded in the tables within the document. And those, we start off with the broad topic areas, then we hone in on core topic areas, and then hone in further on specific topics within each of those broad areas, just to support the usability and applicability of the actual handbook. You will see that in the reference guide, the guide itself is organized into two main sections. One is the knowledge guide, which describes the knowledge areas, as I've described earlier, but also another table that reflects on the knowledge provided above it and hones in more on the associated skills that might be required in the area of cancer care by pharmacists. This reference guide can be used by anyone. A pharmacist at the front line, a practicing pharmacist, or a pharmacist that would like to upskill or enhance their knowledge in the area of cancer care. And it can be used as a self-learning tool for professional development thereof. It can also be a supportive tool in the development of education and training courses in this area. So for those of you that are educators, academics, CPD providers, we believe that this Cancer Guide will be a useful resource for developing programs in this area. On the following screen, I'm just sharing with you an example of how some of these this information is clustered. You could see that, for example, in the first box under the cluster of pharmaceutical care, this particular competency area, we have categorized knowledge and understanding statements under physical health, for example, under cancer types, and which are the main cancer types that you would want to learn and know about in order for you to enhance your knowledge in this area. You could see in the second box that we have provided you with ideas for you to develop your knowledge and understanding in the area of public health strategies. For example, prevention, that first pillar or first area in which you can contribute to the control of non-communicable diseases. And so this provides you a bit of an overview of how the boxes are actually constructed within the handbook. As my colleagues previously mentioned, the publications will be launched on our website on the 12th of October. So do look out for that and look out for our mailing to announce the publication. It will be freely accessible by all members and non-members for your use and professional development. I would like to conclude this particular part of my presentation with an acknowledgement. As Matthew said, we could not have done this without the instrumental support of the advisory group in the case of the development of the Pain and Scarring Cancer Care. I'd like to mention the contributions of the following experts. Dr. Kofi Mensah from Ghana, Dr. Irene Wiro from Nairobi, Dr. Mina Kovacic from the European Society of Oncology Pharmacy and based in Slovenia, Dr. Benyam Molena in the United States, and Dr. Evelyn Handel, who's with us on the call today as one of our speakers. A special mention again to the European Society of Clinical Pharmacy for their collaboration, as well as the International Society of Oncology Pharmacy practitioners. Thanks a million for all your support. I'd like to take 1 minute to talk to you all about the provision through partnerships program at FIP, the program that I lead with an absolute pleasure and pride. As a lot of you would know, or we know, that FIP is the global body representing pharmacy and pharmaceutical sciences and education around the world, where our vision is a world where everyone benefits from access to safe, effective, quality and affordable medicines and health technologies, as well as from pharmaceutical care services provided by pharmacists in collaboration with other healthcare professionals, as just we have seen in this particular collaborative project. So our mission is to support global health by enabling the advancement of pharmaceutical practice, sciences and education. So I'll hone in here about our mission to advance the professional development of our colleagues in the pharmacy profession across the world. And we can do this by this particular avenue at the Federation by providing a platform for our members and our partners to flag, to highlight quality professional development programs, training programs for pharmacists in an array of areas, including non-communicable diseases, including cancer care. And so if you are on the call or a listener afterwards, a continuing professional development provider or an educator with a program, quality program in this area, and you would like to highlight your contribution, your program to the wider audience in cancer care or other areas such as coronary respiratory diseases or diabetes, you're more than welcome to scan the QR code to find out more about the FIP seal at FIP, which is a visible, recognizable sign of quality for a program that can be apprehended to your program, but also it's a visible sign that a program aligns to the FIP's mission to advance pharmacy worldwide and also to the advancement of our development goals, the 21 development goals to advance the profession across all sectors. You're more than welcome to scan the QR code. You're also more than welcome to actually email me directly at dalia@fip.org. With this, I would like to thank the previous speakers and the organizers of this session. Thanks, Ines and Gonzo, for moderation and support behind the scenes. And I would welcome any questions on the Q&A. Thanks a million.
Thank you so much, Dalia, for presenting us this important tool, which identifies the KNS that pharmacists required for the provision of cancer care services. Thanks a million. So now I invite all the panelists to join us. Open your camera, and we'll now move to our panel discussion. And I have some questions from the audience, and I will start with Matthew. Matthew, we have a question. How can pharmacists working in different settings collaborate with one another to provide optimal care to patients with cancer?
Yes, and thank you for the question. I think that we've made reference to a wide array of different roles that pharmacists can play in specifically in cancer care. And of course, that can vary according to the jurisdiction or the practice setting, but there's definitely a lot of opportunity for collaboration as well. So, some things to illustrate could be community pharmacists and outpatient or infusion center pharmacists collaborating together to share information regarding patients so that they can, effectively assess the treatment plan, make sure to minimize the risk of adverse events. We can also think of inpatient or hospital or clinical pharmacists collaborating with community pharmacists as well during hospital discharge to ensure continuity of care and to minimize, the risk of any medication-related harm or medication errors that can occur when patients move across different care settings. So I definitely do think that there's, a lot of potential. We talked a lot about multidisciplinary collaboration. There's a lot of intradisciplinary collaboration that we can do as well within the whole pharmacy profession. So yeah, thank you.
Thank you so much, Matthew. Now I move on to Professor Odedina. I have one question for you. In your view, what is the most simple, cost-effective intervention a pharmacist can provide in all regions as part of the Practice Transformation Programme on cancer?
I'm not sure you're going to like the answer I'm going to give, but the most cost-effective, and that is kind of going through, in making sure that we address the burden of cancer, it's going to have to be prevention and risk reduction. I think, to be honest with you, that's it. We are really struggling with LMICs, and the statistics is horrible. When you look at cancer in 2020 and you go to WHO Global Can data and look at what cancer is going to be in 2040, it's just the LMICs that are carrying the burden. But meanwhile, we still have infectious diseases in all this. So, and we just had, from the comments that people are struggling with the cost, the financial toxicity it is. So we have to really downstage cancer to be very cost effective. And so we have to have professional pharmacists across the body really focus on what are the risk reduction and what are the cancer prevention and what are the really informed screening that needs to be done so that even if you cannot prevent, if you cannot reduce the risk, you are catching the cancer at an early stage so that they really truly ways and a path for moving forward. So that will have to be lifestyle changes, social determinants of health factors. That is a huge thing. We have to address social determinants of health factors, which is where people live, where people eat, the things that affect us, the things that affect our life, and also being able to serve as navigation through the health system. A lot of times when people get the cancer, they are confused. They don't know what to do. So pharmacists can also serve as the navigation system in the health system. So to me, most cost effective is really the earliest stage of the cancer continuum.
Exactly. And Evelyn, I don't know if you want to add something else?
I mean, that answer was about as perfect as it gets, but I guess from my perspective, both in my role with ISOP as well as at NCCN, I also see the benefit of creating bigger picture guidelines and policies. So as much as we can do, since, of course, as I wish we could prevent all cancers, but if we can't, we still have to come up with, how can we work together to address that? And I think collaborative activities like this, working together to establish and work towards establishing policies, guidelines, standards with our ministries of health, with our professional organizations, even within our own institutions. I think everybody on this call could do something to reach out to somebody that they work with at their institution or a colleague and put a project in motion, work together to make one thing better today. And I think, that's how we make incremental steps. That's how we work together as a team to, improve the lives of patients with cancer every single day. So that would be what I would add.
Yeah, exactly. And Matthew, do you want to add something? You all already mentioned that in the handbook, we have a chapter about the prevention, right?
Yeah, you're right, Ines. And of course, I completely agree with what my co-panelists have said. And yes, we do include a chapter on prevention in the handbook that will hopefully help and support the provision of these services as well. Yeah, thanks.
And in reality, this change in lifestyle is so simple to do at the community pharmacy, and we can do this not only for cancer prevention but also for mental health, cardiovascular diseases, chronic respiratory diseases, diabetes. The prevention is exactly the same. Lifestyle changes, physical activity, nutrition, etc., smoking cessation. So that's it. Now I have one question to Evelyn. Let me check. Yeah, what will be your #1 recommendation for the success of the FIP Practice Transformation Programme on NCDs, in the area of cancer?
Yes, thank you. And I think I would echo a little bit from my prior answer too, and just saying, I think together we'll all achieve more. So, working as a team to help create awareness of this valuable resource. I think, again, speaking on behalf of ISOP, I'm really happy that our organizations are collaborating, because I think that'll help increase the awareness. And again, everyone on this call, I think, could help spread the word by posting about it, by talking to colleagues about it. The more we get the word out there, I mean, the information is so valuable, and now it's so accessible in this great summarized format. It's very comprehensive. So I think just taking some time to read through it, use it, ask questions. And maybe another tip too that, has helped me along the way too, is find a mentor. Work with someone who to ask questions, to get some guidance, to talk about ideas. Again, that's just going to help lead us all in a better direction, and I think would really help make this a successful implementation for this program. But amazing, first steps forward, and really exciting to see this out into the world. Thank you.
Thank you so much. Now, Delia, I have two questions for you. The first one is, how is this knowledge and skills reference guide useful to pharmacists? And also, how can this knowledge and skills reference guide help in advancing the role of pharmacists in the healthcare setting?
Thanks so much, Ines. So I'll try and answer maybe to both questions kind of together, being mindful of the time, but also I'd like to reflect on your comment about prevention strategies across all of the non-communicable diseases. And whilst I just want to make this comment, that whilst there are a lot of commonalities, I think it's important for us to recognize that it can be quite difficult on a patient level to actually enact some of these lifestyle modifications or changes. And I think what's really helpful with these particular resources that we're providing you today is that we do actually shed some light on some of the strategies that pharmacists may take on board. Just like Evelyn just said, one step at a time. And it could be one thing that you take on board in your practice to actually support patients, whether it's with lifestyle modifications going from diet to exercise to monitoring some of the therapeutic outcomes or responses to particular therapies. is really, really important. So let's keep this really wide perspective that whilst it might be a little bit easier said, I think it is hard on a patient level, but we have the resources. And the first thing we do is actually raise awareness, like Evelyn just said, and also self-educate if needed in this particular area. So I think, Ines, that kind of answers, how can we use the KNS guide? Well, the first thing that we could do is raise our own knowledge in particular areas that we need to. And I would like to also say that, I would take the KNS guide as a reference and guidance tool. You may not want to be using the entire guide to upskill or enhance your knowledge. You may want to just to hone in on a particular area. Say, for example, you're really interested in public health strategies, then have a look at the handbook, have a look at the companion KNS, and see what has been advised and what we've collated for you with the expert that's on your screen plus others to really upskill and enhance your knowledge. So don't use it as an overwhelming tool, but use it perhaps by honing on the particular areas you want to enhance your knowledge in. Same thing goes for educators and CPD providers. Actually, for them, they might even expand and find and do some alignments with existing courses, existing programs. Where can I improve? Where can I add particular learning objectives, to really expand on this particular, course that I have? So in my opinion, start with what you know today. How can you move forward to build on this knowledge and expand? And that's how we move forward. Thanks, Ines.
Thank you so much, Dalia. So we are almost at the end of our event. So I would like to ask each of our panelists to provide a practical take-home message for pharmacists listening. Just 30 seconds, please. Start with Professor Odedina.
Yeah, I will make it very brief. Two things. Number one, be a champion for clinical trials at your place. That is very significant. Number two, this actually goes to the FIP. I would like to strongly encourage the FIP organization as the umbrella organization for pharmacists globally to think about creating toolkits that will help pharmacists. Pharmacists are very busy in their practices, but we can take golden nuggets of toolkits, and Mayo Clinic Comprehensive Cancer Center will be happy to work with you on this, from prevention to risk reduction to diagnosis. These toolkits could contain the quick things that pharmacists can use, but could also contain information that pharmacists can provide tailored to different regions across the world.
Perfect. Thank you, Evelyn. 30 seconds.
Okay, my message would be just remember that you can make a difference. Remember that whatever you do every day, you can wake up, you can make a difference. Know your resources, just like we talked about today. There's so many great resources out there. Go to them, use them, ask questions of your mentors, but remember you can make a difference and you could improve the lives of patients every day.
Thank you so much, Matthew.
So my take-home message would be that there's a lot of opportunity for pharmacists to promote, establish, and even lead services across the spectrum of cancer care, and that it's time for this potential to be harnessed. Thank you very much, everyone.
Thank you, Dalia.
Thanks, Ines. I would say build on what you know, find out what you don't know in this area, and talk to a friend today about this particular webinar and the resources that are at hand. Thanks, Ines.
Thank you so much. The record of this episode will be made available on www.fip.org. Please provide your feedback to webinars@fip.org so FIP may continue to improve their digital event offerings. Visit events.fip.org for all future events. So one last thanks for your attendance, and to our brilliant speakers, thank you so much.